Good morning, one and all. Myself is M. Monisha, Assistant Professor in Department of Social Work. In this presentation, we see about psychiatric social work under the topic of National Mental Health Program. In this slide, there are many specific objectives in that introduction about the National Mental Health Program, definition of mental health and mental illness, aim of National Mental Health Program, objectives of National Mental Health Program, level of National Mental Health Program, knowledge about the organization, warning sign of mentally ill person, nurses' role in National Mental Health Program or mental health services. The Government of India launched the National Mental Health Program in 1982, keeping in the view the heavy burden of mental illness in the community and inadequate of mental health care infrastructure in the country to deal with it. The main definitions of mental health. The World Health Organization has derived mental health is the state of well-being in which an individual realizes his or her own abilities, can cope with the normal stress of life, can work productively and is able to make contribution to his or her community. Mental illness. A mental illness is a medical condition that distributes person thinking, feeling, mood, ability to release the others and daily functioning. Mental illness are medical conditions that often result in diminished capacity for coping with the ordinary demands of life. Magnitude of the problems. In India, studies during the last 2 decades have shown that 2 to 3% of population suffer from seriously incapacitating mental disorder of epilepsy. About 10 to 15% of population suffer from others emotional disorder and physical disorder. Aim of National Mental Health Program: prevent and treatment of mental neurological disorder and their associated disability, use of mental health technology to improve general health services, application of mental health principles in total national development to improve quality of life. Objectives of National Mental Health Program: to provide mental health care facility to every class of specified population and specifically to those who need of it. Use the knowledge of mental health in the care of general health and social development. To increase the community participation in the development of mental health services and encourage the effort towards self-help in the community. To select essential elements for mental health care. To distribute all the available resources of mental health services on equal basis. Components of National Mental Health Program: training program of all the workers in the mental health team at the identified nodal institute in the state. Education of the public regarding the mental health to increase the awareness. For early detection and treatment, outpatient service and inpatient service are provided, providing the valuable data and experience at the level of community to the state and center for future planning. Improvement in service and research. The team of focus at the district under the program: psychiatrist, clinical psychologist, psychiatric social worker, community nurse, program manager, case registry assistant, record keeper. Level of National Mental Health Program. This program includes 3 sub-programs: treatment sub-program at that village level, primary health level, at district level. Next, rehabilitation sub-program. Next, prevention sub-program. Organization of National Mental Health Program: tertiary care institution, mental health hospital, supportive organization. Warning signs of mentally ill persons. In young children: changes in school performance, poor grades despite strong efforts, changes in sleeping and eating habits, hyperactivity, frequent temper tantrums. In older and pre-adolescents: substance use, inability to cope with problem and daily activities, changes in sleeping and eating, excessive complaint of physical alignment, changes in ability to manage responsibilities at home and school, prolonged negative mood often accompanied by poor aptitude or thoughts of death. In adults, young adults: confused thinking, prolonged depression, feeling of extreme high and low, excessive fear and anxiety, social withdrawal, dramatic changes in eating and sleeping habits, strong feeling of anger, strong thoughts, delusions, seeing or hearing things that are not there, hallucination and suicidal thoughts. Nurses' role in National Mental Health Program or mental health services. Understand the characteristics of mentally healthy person and differentiate abnormal from normal behavior in the community. Identified, refer, follow the mentally ill person in the community. Provide first aid during emergencies. Assist and coordinate the activities related to care of mentally ill in the community health center. Providing training to health worker in mental health care. Supervision and monitor the activities of health worker related mental health care. Participated in various therapies used in treating psychiatric patients. Assist medical officer and coordinate the progress activity related to National Mental Health Program. Organize and coordinate the rehabilitation activity for mentally ill in the community. Conclusion. In this presentation, we seen about National Mental Health Program, about definition and magnitude history of the problem in India, and a objective of National Mental Health Program, level of National Mental Health Program and organization, warning sign of mentally ill person or nurses role in National Mental Health Program or mental health services. Thank you.